And the power is on. Welcome. You are here with Dr. Lux, and Dr. Lux is here with you, right? So tonight we're going to be talking about sciatica, right? Some people say, oh, I got sciatica, and I'm thinking, actually, you got two, right? You got one on the right, one on the left. The body is composed of two sciatic nerves, which is actually the thickest nerve in the entire body, about the width of your index finger. So what happens is, and what's relevant about the sciatic nerve is that not only if it gets pinched that it hurts, is that it actually has 5 origins. It comes out of the lower back, passes through the sacrum, all the way down to the back of the legs, all the way down to your legs and feet, right? So the main thing is that it can affect you if that thing is pinched, if it's under inflammation. But how do nerves get pinched? Nerves can't get pinched without something squishing on them, right? So it's always secondary components to what happens to pinched nerves. So when we look at pinched nerves, not only do we look at the nerves, but we look at the disc. We look at the bone components, right? So the main thing is if the disc is the glue between the spine and the disc is what's creating stability to the spine, right? How important is it, right? Very much so. However, if that disc is bulging and putting pressure on those nerves, because the spine is shifted out of alignment, or the hips are shifted out of alignment, or the other component where the low back can be out of alignment, all those components can be contributors as to why bones can be out of alignment, or really the major factor is that nerves can be pinched. So 50% of all low back pain as well as sciatic nerve pain actually is coming from the cervical spine. So not just addressing where your pain is, we want to actually address where your problems come from and what it could be caused from, right? So it could be so many components that could be secondary creating this primary issue. So the main thing is getting to the cause. If you were to go to someone like your orthopedic surgeon or your orthopedist, they would say, oh, you have a disc bulge or disc herniation, right? But disc don't bulge and disc don't herniate by themselves. Things have to shift out of place or things have to lock down. But what specifically happens is when a nerve gets pinched in the spine, it actually creates the intrinsic muscles to contract, which actually decrease range of motion through that joint space, which actually pinches on those nerves, right? So if the nerve is pinched, right, how good is your power? Better or worse? Right? So you can answer that for yourself. But the main thing is just finding out what the cause of the problem is, right? Like I said, nerves don't pinch on themselves. And of course, like I said, a lot of those things can be coming from secondary issues. So the main thing we want to do is get to the cause. So when we're looking at people's spines, okay, right? In the crazy world, most of the times the physicians will give you non-steroidal anti-inflammatory drugs, which is fine, right? If you want to eat away at that bone, right? But the main thing is that we don't want to eat away to the tissues. We want the tissues to be healthy. So the main thing we do is that the motion is life, and if you have less motion, you get less life. What that's called in the spine, in order to keep the disc hydrated, is called imbibition. Imbibition is what is motion in your back or motion in your spine, which actually creates nutrient flow to that area. So people say, well, how are you going to help me with my sciatica? And I say, actually, I'm going to cause a little bit of inflammation in the spine in order to get the body healing in the right direction, because that puts hydration and nutrients in that area, and now we can actually regenerate that disc. People say you can't regenerate, but you can regenerate just based off of giving the body the right nutrients, just like we can do from the inside out. So, right, if you do have sciatic nerve problems or know anybody who does, make sure you get to the right chiropractor, the right corrective chiropractor that can show you where those secondary causes are, where the primary causes are, so you can get to the cause, so you can get those nerves unpinched, right? So what we want to let you know is that nerves don't pinch themselves and drugs don't unpinch things. So what you need to do, if you are having that problem and you want to get to the cause, you need to go to a corrective chiropractor in your area that knows how to do that and get to the cause of that problem, right? Because if your doctor doesn't understand, find one that does. Dr. Lux. Power is on. Tonight is off.